Collect your equipment. You'll need gauze swabs, gloves, you may need an apron depending on your policy, a disposable tourniquet, an adhesive plaster, a plastic needle holder, normally with a 21 gauge safety needle. Smaller sizes can be used for fragile veins. And a cleansing agent, either 2% chlorhexidine in 70% alcohol or a 70% alcohol swab. And you'll need vacuumed blood collection tubes of the appropriate colour. Check the patient's identity by asking their full name and date of birth. Check the details against their identification band and details on the blood request form. Help the patient sit or lie in a comfortable position. A pillow under the arm will provide support and facilitate venous access. Make sure you have adequate lighting. Decontaminate your hands by washing and drying them thoroughly, or use alcohol gel. If needed, put on an apron. And always put on gloves to protect yourself and the patient. Examine both arms and check which vein will be used. It's usual to use veins in the antecubital fossa. Apply the tourniquet 7 or 8 centimetres above the venipuncture site and adjust it so it's tight enough to impede venous flow but not tight enough to stop arterial blood flow. Don't leave the tourniquet on for longer than 1 minute. To improve venous access, you can tap the vein gently or ask the patient to squeeze and release their hand. Clean the skin to reduce the risk of contamination. Clean the area over the selected vein for a minimum of 30 seconds. Then allow the skin to air dry until the solution has completely evaporated for approximately 30 seconds. Prepare the needle holder by removing the paper cover. Pull back the safety cover and remove the sheath from the needle. Hold the plastic needle holder between the thumb and index finger of your dominant hand, and with your other hand stabilise the skin to prevent the vein from moving. Smoothly insert the needle with the bevel uppermost at a shallow angle of approximately 10 to 30 degrees. Advance the needle until it's securely in the vein and you see blood appear at the end of the needle. Hold the plastic holder steady and then use your non-dominant hand to advance the vacuum blood collection tube into the plastic holder. The order of blood collection is really important, so check which order the blood tests need to be taken. Be careful not to advance the needle into the vein as you're pushing the blood collection tube onto the plastic holder. When the collection tube is attached, vacuum will draw the blood into the collecting tube. When you've obtained the required amount of blood, remove the collection tube from the holder. Keep the needle in position while you collect the next blood collection tube. When you remove the tube, invert it to mix the contents. The number of times will be specified on the blood collection order form. When you've removed the last tube, you can release the tourniquet. Then remove the needle and cover with the gauze swab. Immediately activate the safety feature on the needle. On this one, you push to cover the needle. Dispose of the needle into the sharp spin. and maintain pressure on the wound. Check that the needle site is no longer bleeding and cover it with a plaster. Ensure the patient is comfortable. Transfer the patient's details onto the blood tubes and check that these details tally with the blood request form. Send the blood to the laboratory. Discard the waste into appropriate clinical waste bag. Remove your apron and gloves. And decontaminate your hands.